Ashley Cole, you're doing work on American Indians and Alaska Natives. If there are some particular things, that's already a very diverse group, we know. But if there's some things that you want to highlight that you're aware of on the solution side, that would be wonderful.
Sure, I can speak a little bit to that. So one of the multi-level solutions that has kind of come into play is increased funding and support. So the government has issued several COVID relief bills specific to tribal communities. And so in terms of tribal sovereignty, that those funds get sent to each individual tribe, and they decide how to use those funds. And many tribes, I can speak mostly for tribes in Oklahoma, but also tribes across the country have used those funds to support their citizens. So through opening vaccination clinics, through giving additional funds for education, for elder care. A big thing in tribal communities is we don't want to lose our elders, who are some of the knowledge keepers, some of them who know traditional languages. As I introduced myself earlier, sometimes those languages get lost. So really giving increased support sort of across generations and at different levels to help keep community members going. And one thing that I do kind of want to point out, and I'm sort of back channeling a little bit and then coming back, is that American Indian Alaska Natives in particular were at greater risk, depending on the numbers you see, but anywhere from 1 to 3 to 4 times higher rates of contracting COVID, being hospitalized for more severe symptoms related to COVID, and also mortality. And so sort of thinking about in the community level, really tribes, a lot of them are leading the way in vaccinations and taking care of their tribal members, and not just specific to tribal members. A lot of the tribal communities and healthcare organizations have opened up vaccination clinics to all community members, regardless of tribal enrollment status. So I think those are just a few examples, and kind of thinking about the syndemic that Dr. Clausen mentioned, where a lot of tribal communities initially received fewer resources, less PPE, less funding. Tribal members were contracting rates of COVID at higher rates, and then kind of turn that around, where we see the CDC recently released a graphic showing the vaccination rates across ethnicity and race, and American Indian Alaska Natives have the highest rate of vaccinations so far. So I think we can kind of use this also as an opportunity to learn from what our community is doing, who maybe don't have that individual mindset, who have more of that communal mindset. Let's take care of each other.